bone grafting, soft tissue grafting, implant failure recovery, all of those things. So anyhow, have you marked your X? Just mark the X wherever your heart tells you to mark the X. And then put the cast away. If you have more than one site, especially in the insular zone, you have 2 or 3 implants, 4 implants, calculate where you're going to place the implant, mark an X. I used to love riding motorbikes. I still do, but I can't drive in Pakistan. In US it was good. It was Pacific Coast Highway, close to San Francisco. I lived in Southern California, close to Los Angeles. And that's the Pacific Ocean, the largest ocean in the world, Barrel Kahil. It does not get those hurricanes. Atlantic, ये क्या आ गया? And I was giving that example that when I learned how to ride the bikes really over there, this was a 1000cc bike. The lesson that was taught to me was the day you're not scared to ride the bike, don't ride it. Because that is the day you're going to have an accident. When I learned to fly, I was taught the same thing. Expect to crash at any given moment, look for a place to land. Know where your last airport or landing strip was and know what your next one is if you know it. But still, nonetheless, look for a place to land all the time. Keep the horizon, roll 0, yaw should be 0, pitch should be 0 unless you're taking off or landing. So yaw, pitch and roll with the principles of orthodontics must be followed and flying all the time. Keep the horizon level. You can fly the plane like this, but it puts undue pressure on your wings and your rudder. Keep it straight. You can fly like that, but you have too much drag, so keep it straight. You can fly like this too, but you have too much drag, keep it straight. Principle of orthodontics will fly there, and always look for the failure. You're going to crash at any moment. That's what a good pilot is. Thank God I only crashed the very first time I took my wife on the motorbike. I think I was trying to show off. And lo and behold, coming out of the gas station after filling the tank, we slipped. And she taunted me obviously like that. We slipped. And I was supposed to be the hot young doctor who drive over the rest. What is this? It's good. Yeah? I think it's pretty good. I think it's very good. Look at the teeth. The gums. This is anatomy of good papilla. It's great, right? The tissue has stippling, keratinized attached epithelium, free gingival sulcus, so you can put a probe in there. It's shiny. The rest of it is totally attached. Keratinized attached epithelium is glued. This is where the frenum begins, right? And look at the lower ones also. The papilla goes in, there's a little depression and it's pink. Oral mucosa is darker pink, yeah? It's a denture. Yeah. I deliver this. So I can do dentures for, what is the cost of a denture here? How much do you guys charge, or people charge? 120. Huh? Approximately, give me a figure. 200 rupees or 10,000 or 20,000?
So 1 lakh.
4,000? 120, 111, 120. How about $1,000? 3 lakh rupees. How much the lab charges? I really don't care. I'll pay them whatever they charge, but I want this. And this is the finished product. So when you put this in the mouth, nobody can tell. But I do something a little different. I will twist the lateral a little bit. Maybe give it class 2 div kind of appearance. I've had people who are in showbiz do a little bit more. So it's a long time ago, put a buccal pit filling on First molars. Silver filling.
Natural.
So when they smile and they laugh, you know this lactose illiteracy can't be fake. Not picket fence. And when they polish it, they cannot polish away the teeth. We can't have flat facials. So the care needs to be in you. Do art and science. So we're pretty much it, right? Take the nose to the An implant must go as a natural tooth is. Allah is the best of the creator. Fatabarakallahu ahsanul khaliqeen. Yes or no? Yeah? It's declared and it's accepted. Allah is the best. He's the only one who can do it right. Yeah? So we must follow his example, because his example is always right. Abraham Lincoln said a wonderful thing. He goes, don't say, is God with us? Say, are we with God? Because it's God who is always right. We need to align ourselves with Him. He doesn't need to align with us. What a point. जैसा वो अमिताभ बच्चन का बेटा कहता है, great idea, sir. It's a beautiful idea. So if I'm going to place an implant, I'm going to place it like God did. He created us in His image. Subhanallah. I mean, He doesn't need us, but He says that I created you in my image, and He's proud of our creation. He says, خلق الإنسان علمه البيان الشمس والقمر بحسبان. And He proudly says that I created man, and then taught the man not to speak, but to explain beyond. You know? So when we have a verse, a share, oof, you feel it. That's beyond. And He's proud of that. No other species can do beyond like we can do. Yeah? But कैसी तरह पढ़ाई करती है? आपको नहीं पता। हाँ? मैंने आपसे क्यों पूछा है? Don't say it takes one to know one. But anyhow, beyond. He compared us. خلق الإنسان علمه البيان الشمس والقمر بحسبان. That the sun and the moon only praise the Lord, but He doesn't want it from them. All the angels says we are there to praise you and to recite your goodness. And Allah says you do not know what I know, because I'm going to create man, woman and man, and give them free will to either praise me or not. And I'll be quiet in the day of judgment. He has the most patience. We tell somebody is going to go to heaven or hell, but the one who owns the heaven and the hell has not decided, and he's not going to say till that day, who the hell are we? But anyhow, He's the right one, so we must follow Him. If you want to write down this primary principle. Follow what God created, because that's the best of creation. Follow where the natural truth was. That's the number one step of good technology. And the components are the same. We have examples here too, and I'll have you see it later, what an implant looks like, and I'll pass it around. And this is the abutment that goes on top of it. And on this, we put a crown. So there's an implant which goes into the bone, and here's an abutment. Best implant is the one that has a separatable abutment, which is held together with a screw. So in case something goes wrong with the crown, I should be able to take it off, leave the implant there, and replace the top. If it is one piece and something happens up on top, the implant is screwed. I don't know if anybody has ever taken an implant out. If it is slightly even bone ankylosed, it cannot be taken out. If it is totally lost because of our fault, it falls out. But I always do this three-piece implant. The implant, the abutment, and the connecting screw. Right? So you can call it the root, the prep, and the screw that holds it up. Retention screw. We can name things ourselves. When I teach, I tell people, let's name this nerve, chichu pichu nerve, or anything you want. Once you have seen the nerve 100 times and you have anesthetized it 100 times, you got it. then you can learn the real name, but know the function and where it exists. First, let's find that out. So it's practical learning. And this is what I also show the patients. And then the crowd goes on top. So I tell them, when people say you're going to put a screw in, no. I'm going to put a new root inside. It's just going to be made of titanium. And once the tissue heals around it and anchors, then we'll put an attachment and cover. So they understand. Don't ever say I'm going to screw something. Now the angulation also has to be how Allah created. Because he's the best engineer and he knows how to distribute forces. So we do that. You don't want to place the implant too buccally or too palatally. It has to be right. Optimal is Carlo Spee and Carlo Wilson. It's already worked out for you. Why reinvent the wheel? Allah has made the Carlo Spee and Wilson, right? I know. So you follow those. Now imagine walking like this. It would be very difficult, right? But if you walk upright, then you can walk long distance. Because the forces are acting directly on where they're supposed to act. And even in motion, the forces are distributed properly. So follow that example. Any questions so far? Scale up. I normally start my surgical procedure at 6 a.m. मुसलमान सोते रहे हैं, हमारी तकलीफ सो गई. My patients do come early. When I give my regular residency, like we're going to start on Saturday, inshallah, we start at 8 o'clock. If somebody is 1 minute late, they won't enter. And they are paying hefty amount for learnings. And they get $500 for that day. $100. If you're serious about learning, I'm serious about teaching, then let's respect each other's time. So they normally come over by 7:30, they have breakfast together, and 8 o'clock we start. That's when we learn. If somebody is only after a piece of paper, then you can print yourself. Go to a printer, they'll design it, and they'll print it out, and they'll cost you 500 rupees, and you can put whatever you want, you're the President of the United States. And you're the best in the knowledge is now. You can print yourself. But if you want to learn, you're going to learn right. Normally what I see is malpractice. They're just shoving the implant in there, salesman is telling them how to do it, and then they take the impression, negligence, they don't want to do the homework, and then they send it to the lab to tell them to put a crown on. So I think this is totally based on incompetence because they never took the time to do that. And learning is not only how to do it, but most of it how not to do it. Quran, does it teach you how to do namaz? Anywhere? You just say Warqam Marrati. Yeah? Does it say? It says, see the moon and fast, see the moon and break the fast. That's the Quran. Yeah? It talks about namaz timing very vaguely. In the morning, at night, at the end of the days, in the middle, and the middle is the best prayer, and then the sun goes down. It talks about that. It took us Prophet Muhammad sallallahu alaihi wasallam to learn how to do it right. Quran is full of what? Does it give you rules? No, it's full of stories. Stories of failures. Was Fir'aun a big success? It talks more about Fir'aun than Musa. It talks about Ad and Samud. It talks about Yahud. It talks about the one Qabil, not Habil. Think about it. أَفَلَا تَدَبَّرُونَ? Don't you think, he says, about don't you do reflection on it? We read Quran for sawab, never for sabad. It is so good if you read the translation. Arabs used to say, don't listen to it. Because you hear it once. The words are so moving, you have no choice but to accept. But we don't. Incompetence in religion also. We think it's manasik, it's not healing. So if we do a wrong implant or we cut natural teeth for a bridge, we have to answer Allah for it. I believe that. You see? I hope and I request you never cut another tooth for a bridge. Tell people I'll do either an implant or I'll do a denture, and I'm not going to cut your natural teeth. Yeah, you get the money, but to me it's haram because you're causing bodily damage. First oath we were supposed to have taken, I don't know if they take the oath here or not. the white coat ceremony and oath, you're supposed to say, I shall do no harm. I shall do good. First, you're not supposed to do harm, yet we cut teeth. How can we do good? Look at this case. This guy had come to me, I saw his teeth, took some x-rays, and his whole upper arch had infection. Bone loss everywhere. Lower arch was perfectly fine. This was in the middle of Corona and COVID. Couldn't figure out what happened. So I asked, are you positive? Because what we but इसके heater चल रहा है आपको पता है? The heater is on.
देखो
I have the same problem with higher. You press the button or yes, press. Red light. So anyhow, I told him that what we need to do is take out few teeth at a time because it seems like you have subdivision problem. We will take few teeth out at a time and I'll suture it and I'll clean the bone. And I gave him an estimate, I think at that time, like 3 or 4 years ago, it was some 4 lakh rupees for extraction. So the guy who referred him was a lab tech. He said, don't worry about it, it's too expensive, let me take you to somebody else. And he took him to an HOD. And they took out all the teeth. And they put silk stitches inside. Didn't tell the patient anything after that. He shows up to me again, he's ashen blue in color. This is what the mouth looks like. And this is 3 months after the extractions. And the stitches are still there. So first thing I asked him is, why did you not have the stitches removed? He says, they never told me that had to happen. When we cleaned it up, and I took the stitches out, they were silk. So they were sucking in the bacteria, braided, plus they cause inflammation. This is what the planet looked like. I was going out of the country the same night, so I sent him over to a student of mine, Dr. Salman, he's in Howard and Howard Victoria Hospital, he teaches there, to do the surgery and remove the necrotic bone. His palate was moving, hard palate was moving. And then his palate was totally taken out. This is the hard palate. Silk sutures, not knowing the systemic condition, not knowing anything, incompetence. This is what it looked like on CT scan, 3D image. This was the case. All of this maxilla is gone. The yellow part is the part he's missing part of the nose too. Don't you think that guy has to answer on that? It was totally avoidable, but it wasn't avoided. I think it took us 1.5 years or 2 to get over his fungal infection also. The hospital over there is very good, so I drove out there. That's Dr. Salman in the middle. He's one of my current residents at that time. And he always used to tell me that when you do surgery, after an hour or so, your hands start shaking. I said, because I'm pulling constantly and holding it there, and of course lactic acid will go down. So this was a good opportunity. I told him to stretch and hold the tissue out. Retraction will do your job for 10 hours. And right, he just didn't want it to even eat together with some just I'm done. So we had admitted the patient, got everything taken care of, got done. Anesthesiologist was on board, plus an internist. Everything was clear. We took him into the operating room. He was intubated, and then his oxygen level started falling. So we immediately stopped. It took 1 hour for the anesthesiologist to clear the lungs were full of water. Way later I found, and he has had many complications, way later I found out that he supposedly had a jinn hamzah, but he was going to hamliyat. So when you get into the occult and you do something haram, it has an effect on your body. It's very strange, but it has an effect on your body. Like people who use amphetamines, they rot from inside out, and I've seen that a lot in US. Amphetamine users, they get shot. Some people. Diabetic at 13% HbA1c is not going to have as much damage as drugs, and also occult. Ihdina siratal mustaqim, Allah keep us on the right path, the one that you favored, not the one that you got angry with. The maghdub alayhim wal-dhalin, and the lost ones. Come to the right path, do the right food and strength. So anyhow, we did zygomatic implants, we opened up, the tissue had recently healed up, and we gained access to the zygomas. And we did 2 long implants on the right and 2 long implants on the left side. Plus, there was a little bit of tuberosity left on the upper left side. He had lost 1 tooth, a lot of bone, so we did an implant and the bone grafting was there. But look at the images profile, the way the tooth comes out, implant, and then all this tissue comes out. Now somebody might say you're invading the nerve, right? So for me, the implant has to be long so it can get strength. If it is in the upper arch, the sinus is small, I'll open up the sinus, do more grafting, and do a sinus lift. On the lower arch, I'll open up the buccal, take the whole inferior alveolar nerve complex out along with the blood vessels, put the implant through, put collagen up on top, put the nerve back, put collagen up on top or membrane, and put bone grafting in your nerve tract. Develop these competencies and you can do good implants until a short ones. It's easy. I'm serious, it's easy. It's just that somebody has to make it easy for you and show you how to do it right. It can't be done on your own. So when I'm taking it out, I take it out with Teflon and I hold it there and do all of those steps. You put it back and then you put the patient on vitamin B12 injections. It's great to prevent any demyelination of the nerve. And anytime you want me to stop, raise your hand and I'll stop and explain this step to you. Anyhow, I had done these 2. Later on, because of the fungal infection and the circulatory problems, he ended up losing both of these implants and one of these also. And then one of these as well. So eventually, after a year and a half of healing, people only restored the implants on these 2. And then I gave him a removal partial, a complete denture with attachments, and I'll show you the attachments. This was a case. So zygomatics, the sinus was still open, and this is what we eventually did. Now, when I placed it, I was hoping to place my denture on all those 4 zygomatic implants. As a second thought, I had put the last 2 in tuberosity. I said, in case I needed to restore something or temporarily restore the occlusion, get the bite right, I would do the last 2 crowns, get the bite right, and then do the front. But when we ended up losing everything except 1 zygomatic implant, and the last one, then I had to make an appliance. But this zygomatic inversus angle was totally different than the one in the back. They had nothing to do with each other. There was no parallelism. So how do we do it? I could not find any cases online on how to fix this. So my lab guy and I, we sat down and said, we have a problem. We're going to fix it somehow. And it was brilliant. He came up with the idea. See, so there's no mystery no at all. He says, why don't we do the front one separate and the back one separate? In the middle, we'll make a connection where you put that one in first, and then you put this one in and you cement them together. And that's how we make the substructure, and then we put a denture on it. Denture had an opening, so we snap the back in. I don't snap the front one in. It's a little stitch button type. And female and male component. Male components are built into the header bar, the bar that is connected, plus female is in the denture itself. Now we have to load the front also. So why should we do implants? And the patient will ask you, why did somebody give you one implant? Because we should not do bridges. I think that's a simple thing, and I tell my patient with conviction that we should not do bridges. So why should we not do bridges? That's the next question. That's a very good question. I'm waiting for that to happen. So I'll show you why we should not do bridges. This is a bridge. And some FCPS has done those endos. It's a shame. Then we turn this light off. Oh, yes. बहुत ज़्यादा रोमांचक बन रही हो गया तो नहीं people doze and all. Anyhow, is this an endo? And then a bridge. What bridge? They're connecting teeth. I thought bridge were supposed to be between 2 stands. But what I see a lot here is people connecting teeth. And then they put it on Facebook with pride that patient is satisfied. Patient satisfaction means nothing. Tell me after 5 years if they're satisfied. There was a case when we had to cut the bridge off. This is the inside of the bridge. You know why there is so much cement? Because these are ill-fitting crowns. You're supposed to have a very thin film of cement inside. These are loaded. आप उधर क्यों आ रहे? वो और क्या आ रहा है? दूसरे इस तरह लगा रहे। ये कुछ उधर दे दो। So you guys will be able to see properly. दरवाजे के पास ले जाएंगे। पीछे ले जाएंगे। क्या ले? बट एक इधर ले। Excellent. You'll be able to see that. ये बड़ी वाली पीछे ले जाएंगे। आ जाओ। There we go. Then look at the tissue inside. So these are topi preps, right? Yes or no? Yes. Am I wrong? You just cut the teeth all around and you shoved it down. There is no puncture prep. And look at what happened to the last two. They did GIC inside and shoved it down, and the decay led to the last two. Look how bad it is. And look at the tissue underneath the bridge. Now this is what it is after 5 years, or 4 years, or 2 years, and sometimes even 2 months. You show this to the patient and say, you want this? You get it done somewhere, I'm not going to do it. To me, this money is haram, this procedure is haram, and I cannot be any more sincere. I'm telling you, I'm not going to take this money. You will have self-respect if you take it. You must have self-respect. What is abdiyat? What does it mean? What is ibadat? That's not ibadat. I am his abd. Abd is mistranslated as a slave. This chair is a slave. It can't move till it's told to move. I could be an employee at best. I can choose to take his leadership as mine, or I can choose to be a kafir or a mushrik. मुलाजिम आपका नौकरी आपके घर में करता है, बर्तन उनके जाके धोता है, तनख्वाह आपसे लेता है, काम उनके करता है, सोता आपके घर में है, काम उनके करता है. Is that not clear? But that's what we do. So we are supposed to be his servants, get into his employment and say, I accept your employment, knowing that you are the company who will benefit me with food, clothing, shelter, bonuses. I want all of those, and you have written a contract for me in Quran that you will provide me all of that, and I accept it. So now I will only do good work for the people you send me, because this practice belongs to you. It's your practice. The money that comes in is yours. You get into a car accident, that 50 lakh rupees is gone. The money was never yours. That's why you're supposed to say Inna lillahi wa inna ilayhi raji'un. It actually belonged to him when he took it back. But then you stand there and say, Ya Allah, you were supposed to give me, I asked you for a car, give me a new one. So he gives you a 2 crore car. Now do you have the pinch on the 50 lakhs you lost? To take his employment, people he sent to you are his loved ones. Do the rightful treatment and show to Allah that you're not going to take bribe. He's listening and he's watching. And he'll bless you and give you more money for refusing haram money. Try it sometimes. It'll come in the same day. So I don't believe it, I've experienced it. Okay? So we must do that. I'm not going to do this treatment. We're going to convert this into good independent crowns with sealed margins and good crepes, not crown cutting. And none of the bridges. This is what bridge is, right? If I had to do some 24 years ago, I stopped doing my last bridge 24 years ago, I would do this in anterior region. So they can brush on the lingual. The ridge is all clear and clean. And I would do this in the posterior region, bullet shape design. Everything else is junk. But what I see in Pakistan is that this, or they shove the tooth into the soft tissue, the contact. Don't do this. It should not be done. Yeah? उसने कहा कि जितना तुम्हारा टोटल दिमाग है ना, इतना तो मेरा वैसे ही खराब है. You know, his arrogance and his beef is the truth. Don't be that dog only going for money. Money will follow you if you do it rightfully. It will come to you. It has always come to you. And money is not your risk alone. It's a means. You could own a lot of property, but you're not living in it. Unless you're getting some rents out of it, and then you're utilizing it. But you don't utilize the whole thing. Your servants eat, your parents eat, your family eats, and you also feed your friends and stuff. So when a friend invites you, you spend nothing on them. Yet the deed is yours, that's your risk. So Allah will give you that. Don't take it haram. Don't steal it from your friend. You can ask and they'll get most of the Quran, and they will. You know, like a couple of nights ago I got here, and another friend of mine, he has agriculture land up in Rohi. So I called him, I said, I'm in Multan. I said, come over. He goes, you know how far I am from Multan right now? I said, okay, I'll just be both of them. You know, from childhood. So when he got there in the middle of the night, he goes, where's my bottle? You know what I'm saying? So that was love. I'll just be both of them. Let's do the same thing with God. Why don't we ask him for a good parking spot? Then a sirat al-mustaqim, show me the right path. Maybe today the right path is being shown to you. Sirat al-ladina an'amta alayhim. Show me the path of people who are blessed. Not the ones who got angry with. So do you think Allah is happy with somebody who did this bridge? Or happy with it or angry? Angry because you took somebody who trusted you and Allah sent them to you and you did this to them? And you took money for it? Do you think you'll get a bonus? In actuality, he's going to take that money and give it back to them somehow, and he's going to deduct it from your risk. That's what I see. चोर आपसे कभी चोरी करके नहीं जाता. They took from you, Allah will make it up for you because you cannot take your risk. You know, they say, why do Jews have big noses? Because the air is free, they will suck in it. But all of us can breathe, and you can put 10 more people. Do you think oxygen will deplete in this room? Allah will replenish it immediately because we promised that rest. So come to this service, say, I become your employee. But guess what? I don't want my regular pay that the package comes with. I want bonuses and I'll be good. So I want bonuses every day. Plus I want this car and I want this house and I want this kind of clothes and I want this kind of food. Who else can I ask? You? And you're supposed to give it to me and he will. فَادْعُوهُ يَسْتَجِبْ لَكُمْ. Ask me. I will accept your prayers. How clearly can he write it? We are the dumbos that we don't read Quran with translation because these promises are written like that. My parents made me a hafiz from childhood. So I recognized. Yet I had no idea what I was memorizing. And I think that was a big disservice. So I go out to US and after another 10 years I ended up in Makkah. And the way I ended up in Makkah was a friend of mine called me and said, Imam of Kaaba is here in this masjid, let's go there. So here was my house, that's where the masjid is, and he lives over there, 2 hours away. I said, for Maghrib, no, I don't feel like it, I'm tired, give me. He goes, it's so good, I'm going to drive and pick you up and take you to the masjid. मेरा बोतल पिला था उसने मेरी दी line. I say, okay, I'll meet you there, then we'll go to the restaurant and have dinner. It was done. And I said, you pay for the dinner. He's making a lot of money, I'm making a lot of money, but it's a matter of the bottle or samosa to make it. When I was a kid, a friend would come over and say, we're going to go to Gandhagar to buy the books. And I said, okay, pedal tune chala. You don't know to buy the book. I don't need to pedal. So I'd sit on the seat and he'd be sitting on the carrier and he'd be pedaling. And after like 5 or 10 minutes, we got to like, Farah Pelvi or Chowk Nawasha. I said, "Meri taange rahegi." Please, at least let me sit on the seat. You see? So friends do that. Anyhow, I'm there, and the Imam of Kaaba, I don't remember if it was Shanaim or Sudais, and he starts the Maghrib and he says, Alhamdulillah, and he starts. And I'm thinking about something else. He tried it 3 or 4 times and he got my attention and he could not finish Iyaka nasta'een. He was crying. And I was a hafiz. So I said, what does this mean? Why is he crying? You should have thought there. I decided it's supposed to be all the time. What does it mean? That I'm your servant and only from you do I seek nasta'een. If I need a parking spot, I'll ask you. And it hit me. I think that was a moment of nirvana. It hit me. Something awoken in me. So we got out and I called my travel agent and I said, for the whole family, reserve the seats. I have to go to Makkah. He goes, when? I said, if you send it tomorrow, I'll go tomorrow. At that time, it was very easy. The passport, he collected it. Next day we got the visa. Third day, we were on our flight to Makkah. So I ended up in Makkah, and very first time, here I'm standing right in front of the Hajj. Again, it's Makkah. Just so happened, nobody on my right side, everybody was on my left side. And I did not know when they say Aqama, everybody stops. You don't do tawaf anymore. So wherever I was stopped, and Hajj was right in front of me. So I'm like, wow. And then both sound system comes up and they say, Mom, Ibn Khayyat is reciting Alhamdulillah Rabbil Alameen, and it's just so good because acoustics are wonderful. The sound is beautiful. You know, both system and you're in the center of it. There is no echo and it's not hurting you, but it's loud. And he's reciting so beautifully. And I'm feeling elated. And the idiot right next to me starts crying. Why is it crying? Because this is the end of Surah Baqarah. Lillahi ma fis samawati wa ma fil ard. Wa in tubdu ma anfusikum aw tukhfuhu yuhasibun. Yaghfiru liman yasha'u wa yu'azzibu man yasha'u. Wallahu ala kulli shay'in qadir. Then he starts crying. And I'm saying, what an idiot, you know? It's so beautiful. We are in front of Hajj Asad. And the sound system is so beautiful and the Ababil are all over. But then, you know, I'm the rich man and he's crying, maybe he needs money. So when we finish the namaz, I say, brother, are you okay? He goes, yeah, I'm fine. He was better. So can I help you? You need some money. He looks at me, he goes, why do you ask? I said, because you were crying. He goes, didn't you hear what God was saying? And I said, when was God talking? God doesn't talk to people. Certified, oh yeah. He saw it on my face. He says, no, I'm not crazy. Hold on. We went and picked up a copy of the Quran and was in English. I said, these are the last verses of the second surah. I said, yes, I know. He goes, but you don't know because read the translation, see what God was saying, that there is no God. I mean, there is nobody to run to. It's a room and it's locked. You're the father or the mother and you're going to beat up the child has nowhere to go. So you grab them and you can slap them, and after crying, they'll still call you. They can only come to you. Sayyidina Isa used to say that one night, Prophet Muhammad did only 2 o'clock the whole night. And his wife, Aisha Siddiqa, asked him in the morning, what were you reciting? Because you kept on crying the whole night. Because I was reciting what my brother had said once in Allah in the Quran. I said, what is it? Which ayah that was? He says, there was the ayah where it says, Ya Allah, if you choose to punish them, you can punish them. If you choose to forgive them, please forgive them because they're only yours and they belong to you. Such hopelessness. So Allah declared it that there is no way to run. Lillahi ma fis samawati wa ma fil ard. There is nobody except God to run. You got nowhere to run. And if you think even something in your heart, or you do it, now if he wants, he can forgive you for even thinking of that. But if he chooses, he can forgive you. If he chooses, he can punish you. Because at that time I started crying. I think it was so many bad things. Why? Because Allah tadi mari. Wallahu ala kulli shay'in qadir. Remember, Allah has to answer, not money. He has qudrat over everything. You can come up with 100 Hajj and $1 billion in zakat and sadaqat and never miss a single prayer. But if he chooses to punish you and throw you in hell, he doesn't need an explanation. No, so he doesn't have to answer anybody, and nobody can question it. He says, I'll give you shafaat permission with permission. And now stand up, and if you want to plead somebody's case, do it for me. Because then I started crying. And he goes, at the end, you did not see me smiling because God came and wiped my tears away. And he says, Wafu anna, waghfir lana, warhamna. He says, God told me that ask me. And he tells you to ask me, he means he wants to do it. He told Adam and Hawa, because he taught them those words so they can utter it. Then he'll forgive. Had they not uttered it, he would not forgive. So when he teaches you, that means he is now ready to forgive you. Say those words and you can forgive. Acha, sorry bolo? Okay, I'll forgive. That is done. Because you want to forgive. But you want to make the child realize that all they got to do is say sorry, right? That's all. They don't have to fix a broken glass. So he says, God told me, Wafu, that tell me, ask me to just look over it. Nazar andas kar de jo mere se cheez toot gayi. Then he says, no, if I am going to grab you on this, ask me to waghfir lana. It's a punishable crime, forgive. TV tod diya ek hi tha. Phir mera ho gaya. And he says, Allah says, don't stop, ask me, warhamna, kiss me, and give me love. That's the definition of the rahim. Ask Allah for love. Just like you do to your child. You give them love and you kiss them. And you wipe the tears away. Because you can pass them smile. That's the moment it hit me again. And I said, oof, I cannot memorize no more. I should not memorize no more. And I made a promise to myself to read every single word in translation. Then the order. Then I came to realize it was becoming hifz in me. That's when these ayat then make sense to me. You see? That's when you can cry and you can feel goosebumps. Same thing we need to do in tennis. Learn it, internalize it, make it part of your soul so you would not go wrong. Otherwise, every grain of salt you take is haram. And you cannot go to Hajj and Umrah with that money. Imagine you sell drugs and then you go Umrah. It's a long time. We do this and then we go to Umrah. Develop repulsion against this. Is this good? Would you like it in your life? Because somebody did this and took money, right? So we should not do bridges. Look at this. This is what underneath bridge looks like. Look at this another case. We play all around. GIC. Have you read the bottle of GIC? It says temporary restorative material. You should not use GIC. You cannot use GIC. It's a temporary material. Use good composite, but first remove the decay, make the proper margins and seal them on individual crowns. Imagine it was your mother, your sister, your father, your brother, your wife, your husband, yourself. You do not want that. So do unto others what you like done on yourself. अपने भाई के लिए वही पसंद करो जो अपने लिए करो. खैर निकाय खैर दीदी. What does that mean? I also know Persian and Spanish. My great-grandmother was from Kabul. So Spanish kind of runs in the blood. If you want khair mein khair, if you want khair mein, it will. What goes around, comes around. It will. Even if your teeth don't break down, it is written for you. And then you have to answer for that. Why? Even in Qabr, as Allah says on the day of that, Al-Yawma nakhtimu ala afwahihim. He says on that day, it will be the moment you close your eyes. Their mouths will be sealed. Al-Yawma nakhtimu ala afwahihim. The mouths will be sealed. But the tukallimuna aydihim. And the hands will fall. وَتَشْهَدُ أَرْجُلُكُمْ. And the feet will bear witness. My requirement is that I should be able to eat hard stuff. So we took it off, it was still recently clean. And we prepped it. My last bridge and my last sin. And I did this, it's only touching on the facial. Nowhere else is it touching. And at that, my principle is whenever I do prosthesis, my occlusion needs to be on the other teeth. And you keep this in shim stock pin. That means I should be able to pull 20 microns thick paper through it. 20 microns. A millimeter has 1,000. Artillery paper is normally 80 microns. But I should be able to pull. Then the teeth super erupt that micron, the 10 or 20 microns into functional occlusion. See what I'm saying? So it's a good safe practice not to make it half a million, not 500 microns short, 20 microns. So shim stock is a little question so far. I love poetry, Urdu, Persian, Spanish, English. I think they really give you very good insight into the soul, and the words make a lot of difference. خلق الإنسان علمه البيان الشمس والقمر بالحسبان सूरज और चाँद होके अल्लाह की तारीफ करते हैं, but he's proud of what we can say because we are given free will. Bridge looks good. We must accept, yes. The porcelain work is nice. Cover P is off because there's super eruption up on top. So instead of correcting it with a little bit of ortho, they just did the bridge to fit whatever was wrong already. But don't you see the problem of this one thing? Or this is an abutment, the root exposure? Right? You have to be able to see the problems. When we took it off, this was the inside. The ponting was digging into the soft tissue. Why? Because what the lab does, you had a cast, right? With the teeth that were carved out. Yeah, very good. You see, lab does this. They would take the tooth, which you removed in the pontic area, and they would carve it further to shove the pontic inside. This is what happened. Not only was it wrong on the buckle, it was shoved inside too. This is what the bridge does inside. And one more thing, all of these slides I'll give you. The whole lecture is a PowerPoint presentation will be given to each one of you. I don't keep any slides. So unless I tell you to write something down, you won't have to write anything. A picture is worth 1,000 words. Malpractice, negligence, and incompetence. Yeah? Look at this. A doctor herself came in with this. And, again, sorry, a professor of prosthodontics said like this. Isn't that horrible? So when we looked at it, this was the endo with a possible broken instrument right there and a root fracture. Yeah? A little bit of infection, and there's infection in the back tooth also. And that's how they were walking around. CT scan is a must, I think, in any kind of dentistry beside 1 or 2 fillings. So we looked at this, and very little bone was left inside. And look at the buccal. Sorry, I think it's not part of this part. There's no bone in the buccal district. Very thin. And look at the incisive canal. Nasopathy duct was enlarged. There was cystic activity there also. So in CT scan, we looked at all of that and did the measurements. This is how much bone was there in spikes and how much was not there. And look at the incisive canal duct was enlarged, so we also had to do bone grafting there to fix that repair. And there was a cystic activity going on. These are the slides I shared with the patient also. And showed to them. And this is what we really see. We still have to work on the bottom ones. Anterior is built up. These were taken out. On Saturday we're going to do an implant there. Then in a week or so we'll do a sinus lift. This bone grafting was already done. We're going to do an implant right there and later on reconstruction. Any questions so far?
What was you repeat the last point that we covered back now?
Which one?
The treatment plan about this.
She's only interested in getting the top one done first. So we did the bone graft after this. We took out both of these teeth. This one had an infection going to the sinus. So we did bone graft here, bone graft side. I'll show you. And we have done implants in the anterior region. This we're going to do tomorrow. This extraction was only done about a month ago or so. So I need to wait another one before I do implant there. We need to do a posterior couple of implants and bone grafting to build up the case. So she is in progress. You'll get the poetry also. You'll enjoy it. So this was the anterior region. The canine, I don't know if you remember, take a look here. They had a lot of acrylic stuff in the canine. One of the images will show. So it was an acrylic filling done there along with GIC. Really big mess. This is how we do the case presentation to the patient, and that's what the residents are also taught. These teeth were later extracted. At that point, I had to recontour, do the new composite, clean it up, and we had to coronally position the flap also with bone grafting and magnesium on the canine to regain attachment. Implantology has a lot to do with periodontal surgery. In my opinion, the person who wants to do it should be a periodontist with specialized training in prosthodontics, or a prosthodontist with specialized training in periosurgery, or anybody else who can do specialized training in both ways. But you need to design a crown before you place the implant. So point to right would be, in implantology, the crown needs to be designed first. Tell me how we did the supracrestal, mid-crestal incision, including the canine papillas, because they have to rebuild the soft tissue, and coronally reposition the flap. It was opened up, debridement was done, granuloma was removed, and we also made PRF. There's PRP and PRF, and that speeds up the healing. In the full residency program, we teach how to utilize these drug products and how to make them. And the system is very easy to set up. It only costs 5,000 rupees to set up the machines for PRP and PRF and APRF. Only 5,000 rupees. It just has been made so difficult for people when somebody gives a lecture. They don't want it made easy for you. But if your risk is coming from Allah, when you teach others, Allah will give you more risk. You know, there is not a single tree, not a drop of water in heaven. There's not a single flame in heaven, in hell. And there's no pit in hell either. Both are flat, barrel vents. All the fire you send from here. Every single burning act you send from here, and you light up the fire for yourself. The hell will be very individualized for every person for what they did wrong. Every single canal in the river needs to be dug here for the water to flow. Every plant needs to be planted here. Every room in heaven needs to be built here, not there, because once you're dead, construction and destruction is done. So when they say दुनिया कुछ भी नहीं है, सब कुछ आखिरत है, आखिरत में तो कुछ भी नहीं है अगर आपकी दुनिया कुछ नहीं है. In this world, you need to dig the wells, and you need to trench the rivers. So whatever fire you're sending there will be extinguished with the water you send. And you need to plant the plants now. You see what I'm saying? So when you teach somebody, and I cannot, how much good can I do? How many good implants can I do? How many good no bridges can I do? How many good crowns can I do? But I was taught by Kuffar, Americans. You do good and the good will come to you. So you teach. That's why they have missionary trips. Muslims have a missionary trip. Name one. We go for tabligh and we teach them how to do namaz. That's all. Manasik. But our now, they come over here and they treat you for free with love and they teach you. That's the mission service. So if we did good work and we taught others, let's say you learn something. I'll never see you again in my life. I believe on the day of judgment, Allah will say, well, we taught her, she did good work from then till onwards. So for 40 years, this is your reward from her equal to what she did. And imagine if I get it from 10 people. I'm very lazy. I'm honestly very lazy. I don't want to work very hard. I want to work smart, not hard. So I would rather teach others and let them work for me. They'll get their reward and I'll get theirs too. So if what we talk about pain control wise, for the rest of your career, another 10, 20, 30, 40 years, you do pain control and you take people out of pain, I can ask them on the day of judgment before I die. Arahatan in the Lord. Patients you sent me, I make sure they didn't have any pain. I use the right medic. And I taught also. So thousands and thousands of people were pain-free from the knowledge you gave me. Make it pain-free for me too. And I used it once so far already. I have used this once. My father came down with pancreatic cancer, and pancreatic cancer was very, very painful. And he only lived 6 weeks after the diagnosis. And 4 weeks into it, he started having pain. So he would make noises and try to bear it. His bedroom was right there, and the door was open out. We were sitting in the family room with a rocking chair, and I would watch him all night. So second night he was in pain. I was laying there, and I looked up, and I said, "You कहते हैं ना पजामी चंगी नहीं दिखी थी." And I literally told him, I said, "You know, this man's son, he brought me up and he taught me these values. Takes care of your people, and you know that. Yet he's in pain? Not fair." मेरे ख्याल में वो भी दुआ थी, शिकवा, who are we to? But who else would be complaining? रोटी अच्छी नहीं पकी, अम्मी को कहना है अच्छी नहीं पकी. किसको कहना? Right? So I have that kind of relationship with her. Anyhow, I fell asleep. I woke up in the morning, and he was sleeping. So in the middle of the day. So I asked him, "How are you?" He said, "I'm okay." I said, "But you had pain." Because last night, middle of the night, it just vanished. It dissolved away. I think I had gas. No meeting the next day or the day after he passed away, he had no pain. Once he passed away, that is when I realized कि मैंने उसको वास्ता दिया था उसका, it's not the culture. But I think he was also waiting for me to ask him. We don't ask for pain. But I asked on pain relief on the basis of supposedly what I was doing to others. So imagine if you believe pain and I believe pain. I want my transition from this life into the next to be very delicious. Kullu nafsin zaa'iqatul maut, right? But normally we tell you that death tastes horrible. Then why would a shaheed want to die over and over again? It must taste very good for them. It's zaiqa, it's a taste, but it might be bitter for me, but extremely delicious for the next person. He doesn't say it's a bitter zaiqa, right? So that's what I pray for. So if you're teaching somebody good, and if they change or even lose one thing, the good will come back to you, and you ask that favor in return. From the knowledge he has given you, make a difference in people's lives. That is why I teach, and I try to make it easy so you can implement it. And hopefully we can do greater good for the public among us. Why not? So bone grafting was done. I use a composite bone graft. Doesn't mean composite restoration. It means I use different kind of bone materials to make sure some bone is available immediately, some is available over the next 6 months, and some particles in the cortical bone I put in that are good for the next 30 years, ceramicized bone. And I layer them differently also. So the ridge is totally built up, those 15 millimeter gaps are filled up, and then the membrane is put up on top to contain it. Tie it down very nicely, and then the suture is close together. Membrane is sticking through. We also do hormone depositioning. These are approximated, not strangulated, because the tissue is pink, not blue. Then I make sure I check the patient the next day. In case something is blue, I clip the stitch and do it again. But for the last 35 years, I haven't had that. But still, it's my protocol to check the patient next day. Here, although this was to be extracted, but I still did hormone deposition that because I wanted to have better bone. And once this is extracted, then this bony control will continue. Now the ridge was nice and thick. And I was happy. This is, I think, 4 days or 3 days post-op. Proline. No bacteria on it, no growth, everything is clean. Do you see any red spots where it goes in? If it was a red spot, there will be the inflammation. But it causes no inflammation, that's why I use proline. It's great material. 4O or 5O, not 3O. But I also use scope, I'm able to see 10 times. So magnification and illumination are both extremely important. You see the lesion of the canine is also covered. The membrane is now being populated by epithelial cells with secondary intention. Wherever it's coming in primary closure, it's with primary intention, it just heals up immediately, within a day. Other case, it takes 21 days for the cells to grow from the side. But the membrane is that type that allows for that to grow. Now the same patient who had this kind of bone, after 4 months, look at the quality of the bone. Solid. It was so solid, when we open it up, I can't drill with an implant drill. I have to use a high-speed surgical drill to go in and to puncture through first. Then I don't use drills for my implant placement, I use screw holes. These are screws, essentially, 1 millimeter thick, 2 and 3 and then 4 millimeter. And I screw them in and take them out. They expand the bone laterally instead of drilling it out and throwing it away. I have about 3 or 4 implant kits. The very first one I bought. After that, they're gifts because I teach, but I don't use them. In the wall, if you have to hang painting or something, you would drill a hole, then they would put something made of plastic, if nothing else, matches keep in there. You fill it up and then you put a screw in and it'll be very tight, yes or no? Yes. I do the same thing with the bone. You make a tiny hole, then screw on it, put the screw in, it expands the bone internally, thinner and then larger and larger. Then I stop 1 millimeter short of the width of the implant I'm going to place. So if the implant is 4 millimeter wide, I'll use a screw cone that's only 3 millimeter wide. Then the implant also goes in like a screw tight, and we have good condition of the implant at the time of placement automatically. Does this make sense? But if you had drilled it, you're putting it into loose space. But let's say, hypothetically, by mistake, I made the hole 5 millimeter wide. Implant is 4 millimeter. What should I do? Watch इसकी ढीली तो नहीं डाल सकते. So I take some bone grafting material, I shove the bone grafting material inside and put the implant. Now it's tight again. Yeah?
Can we do it right away?
Immediately.
After
Immediately. But you should not make an arch. But guess what happens? Sometimes I go in, I go to the portable bone, forget about the bone classifications. They teach you class 1, class 2, portable bone, class 3, spongy bone inside. That's only for books. I go in and I put my screw home, it goes in loose. I take it out, I put the bigger one in, it goes in loose. I take it out, third one in, it goes in loose. The bone is soft inside. Forget about the classification. At that time, I'll put in the bone graft, pack it, start with the first screw home again. Now I'm packing the bone sideways. Now the last one is going in tight, and if it's still not tight, I'll put more bone in right now. I'm doing bone grafting and make the socket tight. Then I put my implant and I'm happy. And when you take the X-ray of it, you'll see a zone of bone condensation all around. After 6 months, that's almost like cortical. That's implant stability. Does it make sense? Won't you do it? Paste लगाया ढीला है, 2-3 और डाल दो. Will they burn? Will they cause anything? We do bone grafting in the sinus also. We build the ridges. Yeah, I'll show you examples. But there's certain conditions where you should not do immediately. Does this make sense? Now look at the back one. We haven't extracted these two, that endo and this one. Later on we took this off and that too, and we did the bone grafting in there into the sides. Incompetence should not make you do wrong treatment. Learn the right thing. Once you learn sinus lifts, nerve repositioning, tissue flaps and bone grafting, that is like a chips ही बनाना है ना. You throw them in there. The oil needs to be hot beforehand. The steps need to be followed. It's a recipe. It's that simple. ठंडे तेल में आलू डालने के लिए क्या बनेगा? गच मत मारने. ऐसे करके. पोस्ती की तरह. पोस्ती आलू बनेगा ना. It's not good. And best way to learn is you go to Goldbach and the guy who's making the crispiest chips, you watch how he's doing it, the chips are there. You turn on the fire, you let it really boil. Then they throw the chips in and 30 seconds they're out. Learn from them, learn from people who do it right, and also don't do it for people who do it wrong. I'm going to show you a lot of wrong examples. I think this was like 1 week here. Back one. Oh, this was once we removed the back one also and we did the stitching on the back. Those two teeth were gone. And this is the suture removal, yes.
Why did you start the left of the 5
It was some kind of fracture in the bottom, which I showed earlier. And had a lot of bone loss too. Plus the back one. Look, now this is secondary infection here. Granulation tissue. There's a difference between granuloma and granulation. What is a granuloma? It's pathological. It has chronic inflammatory cells in it. Phagocytes, histiocytes. Granulation tissue is an acute inflammatory response to heal. It has infiltration of blood vessels. What do we call infiltration in both blood vessels?
Angiogenesis.
Angiogenesis. New capillary formation. Remember the function of the new blood vessel formation. So it would bleed a little easier, but it will be very nice and pink. And in this too, you see a little bit of membrane is also showing. So we have different kind of membranes that can be exposed to the mouth and nothing happens wrong. And in the long course, we learn all of those different kind of membranes and how to utilize them. Not that you call the salesman, yeah, membrane, G sir. No, we can't select like that. I pass the cost totally on to the patient. But give them the right thing, they cannot make a decision. Patient satisfaction is the worst phrase you can use, and patient affordability pisses me off. They can go buy a Toyota Corolla and a Honda Civic or a City, but they can't afford the treatment. If they can, then don't get it done. You cannot go to dealership and say, I want a Honda City, but I only got 5 lakh rupees. You say, okay, don't buy it. Yamaha 4.5 lakh ki aa rahi hai, go buy that, or a rickshaw. But we are so stunned with our own inferiority complex. I see people with 6 family members on a motorcycle, but they would not buy a rickshaw. I think they should buy a rickshaw. They have a small car, and they'll be all safe and protected inside. No? But we don't think like that. Social stigma. It's a You can't use it on girls. आपको बताऊंगा उसका कोर्स अलग है।
जी सर। So वो भी 6 months है।
उसको 6 मिनट लगते हैं। You know, my chacha taught me this trick. तो लड़की को सानी हो, especially अगर आप घर आए किचन में मुझे को पीछे जाके डब्बी डाल। If you stab you कहना बाजी डाल गई and it just washes away, not a big deal. Otherwise, अगर वो फंसी तो फंसी, मुस्कुराई चली जाएगी, you're done. Don't use it now. And don't quote me.
So this is malpractice.
This is actually smooth practice. इसे वो कहते हैं smooth operator. ये बीच में से निकालते नहीं ये मशहूर.
ठीक है. So ये तो मेन चीज़ है.
Look at this. MashaAllah. Where are the implants placed? Does this have anything to do with the teeth? This is the arch, and wherever they could, they put the implants. When I send my implant to the lab for finishing, I place the implant abutment on, take the impression, take the abutment off, and on the implant, to heal, I would place healing abutment. Then when I've taken this off, we have a fake implant called implant analog, but you can call it spare fake implant. You put the abutment on it, you tighten the screw, and with the orientation mark, you put it back into the impression. You put it back into the impression, you send it to the lab. When they pour it, they've got the exact abutment to put the crown on. So the margins will be excellent. Does it make sense? Do we get it?
Right.
How simple can it be? So instead of taking an algebraic impression where nobody can see the margins, here, do you think the margins are going to see? In this enlarged view, you cannot see the margins. Let alone the lab there. So the margins will be open and bacteria will colonize. So it's that simple. But look at the placement. Lab guy and Karigar, of course, they're not going to let go of money. They don't have the backbone or the guts to say this is wrong, I'm not going to do it. It's money only, it's only business. So this is what they need. And look at the coverage up on top. Do you think anybody can even get piezo inside? Or even swishing water can get inside this? And look at the lingual. Would you have this in your mouth? Does this look like even human arch? You know why? You are incompetent to make the bone. This, what is this? This is the prosthesis? Look at this guy. Impression of an implant, double implant in the member. Look at the soft tissue. They do not know how to do soft tissue grafting or bone grafting, so they place the implant wherever and they call themselves surgeon. Only 2 TIA card, is this surgery? Orthopedic surgery is to rebuild it. The orthopedic surgeon builds a bone, hand and foot surgeon comes in and rearranges the tissues and muscles. Now you've got something done. Chocolate or precise done and finished. But we don't want that. So this is the attachment, and yes, the upper incisors are incisor spike, they're on the inside. Does this make sense? The whole arch is in proper occlusion except the centrals. And look at the margins. They say we don't know where the margins are. Look. The two put in the middle are also not matching each other. Are we going to stand in front of Allah and say, yes, I did it? On the other hand, Allah Ta'ala says in the Quran, the one who is fearful, standing in front of Multan, to stand up, Rabbihi, in front of his God, upon God, just to be fearful. I have two paradises for him. Jannatan, not Jannat, but Jannatan, two. And the smallest Jannat, width is more than the distance between earth and the heaven. First slide. 38 billion light years away. Just to be fearful. So एक में रह लो, उसके बाद वेकेशन के दूसरे में चले जाओ, तो वापस आ जाओ. अब सवाल ये उठता है, मौलवी साहब ने मुझसे पूछा कि उन दोनों जन्नतों में अलग अलग हुए होंगे कि वही साथ जाएंगे. Are you married? Good. Ask that question of your wife and you'll find out. Wherever you get married. My wife is called. Hello? Okay, so this is what was made then. Now look at the inside. Can you even call this a fountain? This is a big curvature. Now, here is the artisticness of the lab gap. You connected it there with that space in the middle. Look. You know? All hell is breaking loose. Nobody cares. Look at the margins. Everything is connected. So do you think this implant is going to last with both of these implants? Unless perio department totally dies. Do you think this will last? Patient is satisfied, money in the pocket. Tikka kadai tonight. Haram. Surya haram nahi hota. Aapki barkoot bhi haram ho sakti. Right? Imati Islami कहते हैं अपना किरदार से बंद किरदार होगा. This is not possible. Even on implants, people are doing horrible bridges. Joining implants and natural teeth into bridges. You cannot join an implant with a natural teeth. Why? You distinction where are you? Both of pass on Perio, the tooth at PDL. Implant doesn't have to do that. So guess what's going to happen? Nothing will happen with the tooth, the implant would have no loss. तार तोड़नी होती है, आप उसको ऐसे से करते हैं. Implant is not going to break, but the bone will be gone. Undue pressure. So we can't connect them. आगे से बाजी ये जवाब दे तो दुख तो दिखता है ना. दुख तो होगा. लेकिन ऐसे कामों में ऐसा तो होता ही है. कोई और बाजी से तू नहीं और सही और नहीं और सही. आपकी वैसे रेपुटेशन अच्छी नहीं लग रही. I just get the vibes, you know. I've never met him in my life. Pathan है, but कभी और ना खुशबू लगा. Pathan ने दिल तो हर एक के दिल में होता है. But he's just more successful. Who can do implants? We talked about it. What skills do you need to have to be able to do implants? One, fixed prosthodontist with excellent perio skills, and you can gain both of those. Or an excellent periodontist with these skills, bone grafting, and all of that. Right? But we gain none of this. Because namak haram bone, unfortunately. In US, there's a lot of referral. So much so that in case somebody refers an endo out to somebody, the endodontist will only do endo. You can request them to make the space for post. But by law, they cannot place the post. The patient will come back to you, you place the post, and you do the build-up and you do the count. Let's say somebody needs to have a specialized count done on a prosthesis, you send them out to the prosthodontist. They are limited by law to only do prosthodontics. They cannot place an implant. They'll do the prostho on it and send it back. But you can do in collaboration with the prosthodontist, say, I want to do this implant case. Design the prostho as a denture and give you the surgical guide where the center of each one is going to be. They're supposed to make that. One case I'm going to share with you is some surgeon who put a case out that they did 6 implants in half an hour. But all of them were placed wrong. So when I pointed that out in a group, he happened to be a group member also. So he came back and I'll show you the conversation. And I still told him that you have to, the principle is still violated, even if the case is not complete. You have to do more extractions on the posterior, but these 2 implants are too close to each other. Then we extract the posterior, now this implant is still not in the center of the last tooth that we're trying to restore. And then the prosthodontist told you, did they make you a splint? No. So in US, they can design that and send you a splint back, and I'll show you how to do it. And you use a splint as a guide to place the center of the implant wherever the tooth is going to be. And I'll teach you how to do that. It's very simple. You can do it yourself too. A lab guy can make you a splint to find the center of the implant. Now, this guy was also father of one of a doctor practicing and now doing FCPS in Lahore. He came in for an implant. Once I lifted the flap, the ridge looked pretty good. But once I lifted it, there was a cavity like this. And the ridge was very thin. I could not place an implant that day. On him, since it was a single implant at that time, I did not do a CT scan. I should have. So once we opened it up, I placed the bone in there. This is DM bone. It's porous, 0.5 millimeter granule size. And before that, what we do is, I would take this cortical bone and I would do osteoinduction. What is osteoinduction? You have to tell the bone to make bone. And the bone only forms bone if it is injured. You remember from physiology that you have intramembranous bone construction and you have bone inside the collagen, right? The bone cells will go in. So what we do is we take a surgical word, quarter millimeter round, we puncture it all over. Puncture the cortical bone in 50 places. At that time, I let this periosteum get contaminated by the flying bone debris and bone section. So now all of those bone cells are stuck here too. And we have a lot of punctures. Once we put the bone there, bone graft, and I close it up, हमने जाम लगा दी है bone graft. So all of those little cells that were broken, they will release chemicals, biomarkers that were injured. So they'll take the undifferentiated mesenchymal cells. Remember that in histology? They will then differentiate on the basis of chemical signals being given out by injured bone. And then new bone starts forming, not only from inside out, but those jab laga hai na, there too. So the bone grows from all over, and within 2 months you have solid bone. If you were to put bone grafting there and cover it back up, it will take about 2 years for this bone to grow because the osteoid will stay outside and the bone eventually will grow from here to there and here to there. That's osteoconduction. But we can speed up, we can put this on steroid, not only by puncturing, but imagine if I were to put PRP in it. Bone morphogenic proteins will be released from the injured bone, and healing proteins are right there in the activated PRP. You really get this going on steroid. 2 months later, you open up, and this is really solid bone. Really solid bone. Put this in, and then I'll show you later how we put the implants in there. What is that? Now we put up in. It causes these fractures. Now, that'll make the fracture open. This location will be connected. Be careful. This bone is also broken. We used to use this area to take the bone. And even that took 2 months to heal. Patient had not okay. Now we're doing hard rest bone from the hip. क्या यही पे आ रहे हैं? हाँ यही पे आ रहे हैं।
So the last time we have
ये
been
वाला?
cavity thing.
ये भी fill it up into convexity.
So how do we know कि कौन सी like place में हमें कौन सा like bone use करना चाहिए?
जो मेरा long course है ना, that takes 300 hours approximately. We discuss all of this. The bone grafting lecture takes me about 40 hours. Normally my lectures are 10 to 12 hours long.
Normally.
Plus then we do hands-on. So we use different kind of bones. Plus then those residents come with me and we at the clinic we do the bone grafting. And then we open up that tissue for the patients we did 2-3 months ago, and they get to see how the bone is now and how we place the implant. Plus then we have ongoing cases of reconstruction of those. So first of all, in those 6 months or so of the course, which is once a month, they get to see the things we did during the course, plus beforehand, so we get a holistic view of how things are happening. You place the implant and the second day review and 1 week or 2 week, taking out the stitches and how to reconstruct. And then I send them to the lab also how to design the crowns on it. And we bring the crown back and we hermetically seal it. So all of the processes are taught, beside knowing what not to do. And there are about 3 different kind of bones I use, 3 to 4, that I have come across in the last 35 years that I found to be very good. So I recommend those are the basis of why it is here. One of the residents, he actually bought one of the bones from a local supplier, but his bone grafting failed. And he came to me, he said, this is completely failed. So I said, give me everything, all the pictures. The bone particle size, instead of 0.5 millimeter, he bought 2 millimeter bones. I said, you could buy 2 millimeter, but you have to crush it because I particularly said 0.5 millimeter gets you this result. So the recipe is there, but you must follow it. Now when we make PRF, I use Dr. Chopran's technique. You're supposed to spin it, draw the blood without hemolysis, then spin it in the centrifuge, and the centrifuge is supposed to be kept in the freezer before. It has to be cold. And the centrifuge for exactly 10 minutes. If you cannot turn the machine off, you have to slowly turn it off. So the centrifuge forces act and slowly it stops. You take it out, then you harvest the activated collagen and the fibrin, and you cut away the blood. Then you take away serum from it even further. Then you combine it with the bone grafting material put together. So those formulas are written also, and they're shown, and you practice it. So our residents, they're supposed to establish an IV on each other, take the blood out, make the blood products. जब किसी को सुई चुकी हो, उसको भी याद दिया. But this one guy, he got swayed into buying whatever was available, just cheap, but it was wrongful one. So you cannot just call the salespeople and say, give me some bone grafting material. No, you have to know what you're ordering and where to use it. Then we have ceramicized bone. I normally put it as a cortical bone up on top. This given bone is going to last 6 months to a year, meaning like it takes that long for it to totally dissolve. But the ceramicized bone that we put on top will last 30 years. So it becomes cortical bone. So you have to know, that's why I use the word composite graft. And you have to know which bone and when to use it and how to use it. And there are different kind of membranes too. We have collagen, we have pericardium, bovine pericardium, plus we have cellulose. We also have titanium or Teflon. But each one has a usage for specific function at that time. And we talk about it and we show it and demonstrate and we do it. That's why The 12-hour lecture, we start with a breakfast, we have pakora in the morning and tea, and then we have lunch, and then we have snacks in the afternoon, then we stop with the dinner, we have dinner, and then we're done. And nobody's sleeping because खून सीन चलता है, सेम खून से चलता है। टी ब्रेक में यहीं पे चालू है। We already started at 10 o'clock. 7 बजे। This is my clinic, the one in Lahore. I like choice. The clinic is for me. I need to enjoy it. So I cannot sit there in front of patients and say, They'll think I'm a cuckoo. But I do have this stuff out. And this is a great barrier breaker between the children. When the children walk in, it's a beautiful shoes. I love your shirt. Because that's all that matters to them. And the hair clip. And so let me show you my choice. Let me show you the choice of the child who was crying outside in the parking lot and all his friends with him. And it totally breaks out. And even for the people who come in and wait in the reception, it's not a waiting room, it's a reception room. And we have good stuff. And that's my wash hall. Fitful. On the wall I have butterflies. They don't actually, and I give them a pencil or another toy as a gift. I always do. I love this car. You recommend it as art. There's nothing off with it. This is just a reception room. We have a good TV, and they get to watch. We decorated it like a living room or a family room instead of going to. Especially when you might not be the other benches, they are horrible. And secondly, we have no clocks and no locks. My operator door is open, so the parents can see all the time and they can come sit inside too. And we have no clocks. I don't want them to be reminded of the time they spent. Because normally my appointments are 5 or 6 hours long, I'm doing everything in there. So whoever came with them, got the TV on, we give them Wi-Fi code plus YouTube, they can watch whatever they want. Not stupid Geo News with Geo Baro. I don't want them to worry about it. And so when I give them the YouTube channel, I say please watch anything except news. And normally you put that high definition scenery with background music. You can leave that on. It gives great ambiance. And have that for the people who come to the patient. And then we offer them tea and lunchtime. We get them aloo or naan or whatever. It's a homely environment. It's good. If I'm doing endo, I'll put Teflon inside, put cabbage or second let's eat. And they feel very comfortable. They eat, go in there, have them rinse and brush, take out the Teflon and you can go out and go again. I love airplanes. I have a huge one that I've built with my carpenter. It's in my gym that I should use. And it's hanging on the roof. I love these things. I gather these knickknacks from all over the world. And by the way, this is the cabinet. What was that? I think this was in July, the day before we did the last course. And you were doing a sinus repair on somebody. He's an ex-resident who did an implant and got lost in the sinus and it went to the true hospital. We were trying to find it for him. This is how we had done the implant. And so immediate placement? Yes. This was not immediate placement. But he did not do a CT scan. So what he thought the bone was this thick. Perception and perspective are two different things. What do you think this is? What is your perception of it? And I'll give you my perspective. What do you think this is? Say it.
Friendship band.
तस्वीर
Just मेरी शादी हुई है, मेरी friendship नहीं होती, मेरी दुश्मनी होती है. It's an animosity band.
तस्वीर
This is tasveer. That's the perspective. Perception and perspective don't have to meet. But here's another thing. I don't know how many leaves are in there. अंदर तो बेहिसाब देंगे ना बेहिसाब दे नहीं सकते. गिनने की चीजें रोजे हैं, नमाजें हैं, ज़कात है और तस्बीह फातिमी है नमाज का. So if you're going to do praise the Lord, then praise it, and this should be reminded. I don't do one at a time, it's just like. And then whenever you're done, you just write back on. So I would recommend the same thing. elastic and banana, you can slip it back. It kind of reminds you. But don't come anytime before. So anyhow, this was the reality. He had not done CT scan. So he had perception which was totally wrong. He did not have a true perspective on this. So he placed the implant and the bone was here, he sunk it in. Now, this is the top of the implant and this is the platform. So he only had about 1.5 millimeters into the bone. Only 1.5 millimeters. 13 millimeter long implant cannot be done by 1.5 millimeters of bone. We need at least 4 millimeters. The studies have proven that. And then no proper instructions were given. I look at the patient, do you smoke? No. Do you exercise? I said, jog. 1 month no jog. You can duck whatever the wife throws at you, but that's about it. No surgical for 2 weeks. And then implant is back in the full possible region. At the back of the sinus. So when we did the CT scan, this is how it was named in the back, stuck behind the skin cavity. This is another view. Yes, there's a little bit of bone there too. You see that? That's a CT scan. Learn how to read CT scans, please. Don't do a single implant, even a single implant without CT scan. Here's the key. People come in with bone prosthesis, I immediately get a CT scan because a lot of those teeth have periapical lesions, they just don't show OTG. They don't show periapical. You need the slices to see the CT scan. And once you see it, you show it to them, then they'll seek treatment. So even if you wanted to make money, you're not making the rightful money because there's money to be made, but you can't diagnose it. Somebody has old crowns, no CT scan, no other work to be done. And if you can tell them with confidence, I'm going to get a scan on you, get it done from there, bring the disc back to me, not those slices. If you have the confidence, you have the confidence. People don't question me about the scan. How much is an OPG? What is the cost here? How much is a CT scan? 6,000. They have no problem. They're going to be spending like 4, 5, 10, 20 lakh rupees with you. You need that scan. Do you do HbA1c?
Yes.
Somebody to think, do you do thyroid panel 1c?
Yes.
Somebody to think, do you do thyroid panel? We need to get into internal medicine also. The bone grafting, we need to get into internal medicine also. The bone grafting you do, is it going to last? You should see the science. Anyhow, so this was a case. When we did the measurements, this was the window we were going to open. Why would the window stop here? Because I did not want to cut the nerve supply on this tooth. It's going to come on the buccal side in the bone, not through the empty sinus. So this is how the designing was done. The patient was told about it. And this was a periapical. And here was a zygomatic arch also. And you have to be able to instrument. So we open up the window, rupture the membrane. Should we rupture the membrane? I think so far I have ruptured only 2 membranes on purpose. I don't know if I have the first phase. The second one was somebody came down, he's a pediatrician, and he came in for a repair of this sinus because somebody had placed the implant into the septum and half had bone, half didn't. And we looked at the CT scan, he had a huge cyst on this side, and he says, I've been going to pathologists, radiologists, and ENT specialists. Nobody was diagnosing it. And then I showed him, take a look at the CT scan. We have a cyst here. Don't you have a yes? Then he said, can you please do this side first? Remove the cyst before repairing the sinus. And can you please do it today? We were busy, so I had to have him come back at 5 o'clock. I normally start in the morning. And 5 o'clock I'm home. So he came at 5 and took us 2-3 hours. I opened up, ruptured the membrane. I saw the cyst inside and we decompressed the cyst, securitized the cyst, sent it to the lab, Chocofan, and it came back non-malignant, just cyst. And then we did PRF, not PRP, did some bone grafting and lifted the sinus and closed it out. Anyhow, here we had to do the same thing. And once I went in, I took the instrument inside and I lifted the sinus completely. I did not want to rupture it. And I wanted to make sure that the implant was not ruptured in the sinus. And I got to the implant, I moved the sinus away, then I had it moved on the globe. Then put pressure inside and the sinus membrane came back, so I knew it was not ruptured. I put it back, and then I went to the implant to try to retrieve it. I found out it was totally covered with bone. It had osseointegrated what it is designed to do. An implant surface is so good, if it comes in contact with the bone, without any membrane inside, the bone will grow on it. So it did what it was supposed to do, just in the wrong place. Why? Because of miscalculation. Okay, quickly sir, whatever you want, I'll go ahead and fix this.
शादी में तो ऐसे ही जाना